BSI, scene is safe. Hello, sir. How are you? Anything? Nothing. Okay. Scene is safe. Mechanism of injury is that he has fallen off of his four-wheeler when he hit the tree. Number of patients is only 1. C-spine is being considered. And additional help is on the way. I called ALS just for backup. My chief complaint is that he has fallen off of his four-wheeler and that he could have a head injury. My level of consciousness, hello, he does not respond to any verbal. Let's try pain. Oh, he responded to pain. So, he's alert, but not very well. The chief complaint, again, was that he has a head injury, as reported by the phone call in for 911. His airway is not patent, and his breathing is shallow, so we are going to bag him 1 every 6 seconds. And there is bleeding underneath his head and underneath his leg right here on my gloves. His skin condition is still warm, but he is sweating as well. His pulse is rapid. Now I'm going to do my head to toe assessment. I'll feel his head. Okay. His chest. Palpate his belly. Check his hips. Okay. Pulse. I am calling for more, I am going to be transporting this patient. We are going to put him on the backboard. Okay, here's the backboard. I am checking his spine for any problems, putting him on the backboard. I'm now going to check his pulse, his blood pressure, his ventilations, his skin condition, which I already did, his pupils, his GCS, and the pulse oximeter. Associated signs and symptoms. Does anyone know if he has any allergies, medications that he's taking, past medical history? What's the last thing that he ate? OPQRST is not appropriate at this time. And now I'm going to do the formal assessment. So right now I'm going to feel his head. There just seems to be a gash right here, no actual deformities. I'm going to feel his neck, feel his arms. Okay, feel his other arm. There seems to be nothing there. Good. Okay. Feel his spleen. Palpate his belly in all 4 quadrants. Okay, checking the hips again. They were good on the first assessment, but I'll try again. Okay, there does seem to be bleeding right here, but it just seems to be another gash. We might want to splint it just in case, because there is a little bit of a bump here. Pulse is still present. Pulse is still present. We are going to be transferring this patient. We have not come up with any negatives in this situation because there's nobody around for us to help. A pertinent positive is that he does not have any skull fractures or anything like that. The diagnosis is that he's just intoxicated and that he's not able to be alert. Our treatment plan is to get him back to the hospital and get him on an IV to get all the alcohol out of his system. I am now on my reassessment, which is going over my first assessment, my secondary assessment, another set of vitals, and evaluating the system.